Now, again, back to Brazil, Doctor. You apparently had an opportunity to interview some fellow physicians in Brazil. Is that correct?
One physician. I was saying physicians before because we had promised this individual total anonymity and secrecy, and so I synthetically multiplied the number. And
I see. All right.
But it is one individual.
The doctor that you interviewed, let's roll through that interview a little bit, all right? Exactly how did it go? What did you ask, and what did he say?
Okay, we knew that one of these creatures or beings, for lack of a better word, was taken to two hospitals in Varginha, and at one of the hospitals, which was Hospital Regional, one of these beings underwent some treatment.
Wow. You're telling me this creature was, taken to the hospital by the military there?
The creature was taken to the hospital by two military personnel. One actually held the creature on his lap and took it to the hospital.
Really?
This is another story because that individual died within 2 weeks after exposure to the creature.
Cause of death?
A total secret until probably just recently because there's just been a conference in there, and another doctor who treated this individual, I understand, has come forth and is spilling the beans as we talk. So I will have that information shortly.
Suspicions?
The sister of the deceased military police officer described symptoms that to me were very similar to Ebola infection.
Oh, my God.
So, everybody says, why don't they land on the White House lawn and come out and shake hands?
Yeah.
Maybe if they did, we wouldn't be around long to talk about it.
Well, I don't know, Doctor. For a long time, I've been very suspicious and uneasy with the majority opinion in the UFO community that these are warm, fuzzy little things. I've never felt that, and I've always felt very strongly the possibility that no matter how you look at this, and I stand back and look at the reproductive experiments and that kind of thing, and, I'm not thinking they're acting in our favor, and I'm not so comfortable with the fact that they're warm, fuzzy little creatures, and I think the UFO community better get over it.
I think that, my advice to the UFO community in general is they better wake up and get scientific and drop some of the illusions that have been floating around for years.
Good luck.
But who knows? Yeah. But anyway, back to the story, because this is so important.
Please.
One of these creatures was injured, and that's the one that sat on this poor soul's lap, and he was taken to Hospital Regional, met there by an additional military contingent who took over a portion of the hospital, the surgical wing, and this is not a big place to begin with. And there, the creature underwent some sort of treatment. We didn't know until this witness heard I was coming to town and called Uberjar Rodriguez and said that he would be willing to talk to me, not as any kind of a UFO investigator, but as a colleague.
Yes, yes.
So a meeting was arranged. Nothing was allowed to be taped. There was no video, no recording of any kind. We met him. I took my traveling companion who was acting as my cameraman, Ubirajara, and his son, who acted as the translator.
Why this provision of no recording equipment?
This man was frightened to death. This, for him, was a catharsis. He had not spoken to anyone in 6 years. He was threatened not only with the loss of a job and his license, but he was threatened with a little more serious consequence.
That would all do it. That would do it. All right. So obviously no recording equipment. He'd been, really apparently had his neck wrung out by the military down there.
Exactly.
Yeah,
and
all right.
When we got there and the meeting took place, a disclaimer was the first thing out of his lips. This didn't happen to me. These were rumors. These are things that I heard about. I have no relationship at all, et cetera, et cetera. If you want to hear this, I'm willing to tell you about it. And we said, oh, absolutely. So we sat down and we started the questions rolling. And of course, the information I got was through, like you mentioned earlier, through interpretation. However, when it came to the medical terminology and the medical lingo, we were one-to-one. It didn't make any difference whether he was speaking Portuguese and I was speaking English.
Yeah, it makes sense.
We were able to understand, and I got more knowledge out of that than what came from the interpreter's lips.
Then tell me about that.
Well, as I said, he started with a disclaimer, but then when he started talking about the events and what happened, and
well, that's what I want to know: what the events and what did happen. Yeah,
he was not told what this was. There was some emergency. There was military in the hospital. That wasn't surprising because they had accidents happen on the base, and they took in people and etc. So he was not surprised to see a military contingent to the hospital at all. He was taken in, asked to go into the surgical wing of the hospital, and military guards, after he went in with a couple of colleagues and assistants, were closed off into that area. And he inquired as to what was going on, and they told him that it wasn't his business, just to follow directions and do what he was told. To cut the story down so it will fit in, we get the important parts. He was taken into the operating room. There was something lying on the table that he knew was short, covered with a drape sheet, and he thought, oh my, this is something because it's probably a child.
Sure.
There's a serious injury here. So the doors were shut. They told him, don't come out until he's resolved the medical problem. Don't ask questions and just do your thing. Very matter of fact, do it. Make sure the patient's alive, and then he can come out. So he was there with the surgical personnel and so on. There were some X-rays that were up on the view box. He looked at the X-rays and found that there was a compound fracture of the leg. And at that point, he went over to the table and started to roll back the drape and was horrified because he looked at it and he thought that this was some kind of terrible, horrible deformity, human deformity. But as he began to examine what was laying there, he realized that this was not a human being at all.
Not a human.
And he described it very similar as to what the girls described, a creature that was about almost 5 feet in length, with a large head, a thin neck, brown, oily-colored skin, no body hair, no facial hair, no mustache, a tiny little nose.
And he gave it to you in that detail?
Yeah, in that detail. And, I'm glad you asked that, because at this point, his demeanor began to change, and you had to sit there as a witness and watch this to completely understand the emotion now that was filling the room, because it was only a short time after this. I mean, it was easy to realize these weren't rumors. He was the guy.
Yeah, I've got it. But in terms of this wasn't human, but apparently it had what we would think of as a leg, and it was obvious that there was a bone.
Yeah, so it was a broken leg with the bone sticking out through the skin.
So we know already that the metabolism is fairly similar to that of human beings in some ways, right? The construction.
Yeah, we went through a lot of detail, which I don't have time to go into at all, but I'll mention a few things. I asked them about the blood and the bone. I said,
right.
What's the blood like? Is it blue and, jumps around on the floor or what?
Yes.
And he said, no, the blood is very similar to human blood, even with the cellular constituents. With one large exception was that there's a set of little small white cells called platelets. And the platelet reading, he said, was about 10,000 times higher than in human blood.
Wow.
And that it clotted almost immediately as it came out of the blood vessel, but he didn't know whether this was due to increased platelets or whether the blood was being exposed to an atmosphere that was different than where this thing had come from. He said the bone was, again, very similar to human bone, except it was a little more pink in color. And then it contained what is called medically lacunae. And these are holes or apertures that are in the bone. He said it almost looked like osteoporotic bone, which in human is a diseased bone, which the calcium drops out and has holes in it. But he said because of these internal lacunae or holes or apertures in the bone,
yes,
the tensile strength of the bone was much, much stronger than human bone. And, he knew that what he had to do was to, of course, put the bone back, set the fracture, and so on.
Yes.
And at some point, he said he lost control, and that whatever was happening was that whatever was laying there was controlling the movements of his hands.
Holy mackerel.
And he reapproximated the bone, and he said when the ends were reapproximated, in other words, put together.
Stop you for a question. Was there any anesthetic?
Yes, they were afraid to administer a gas anesthesia because they didn't know what this respiratory system was like.
Right.
So
right.
They guessed, that it would react to with a local anesthesia. So they used it. But even after they used it, they didn't know whether it was producing anesthesia or whether the being had control over what he was feeling.
Yeah, exactly.
Once the bone ends were approximated, he said he couldn't move it.
Did the creature make any noise?
No.
No noise.
No noise, but it did move on the table. It had head-turning movements.
Uh-huh.
And there was a lot of rumors in this case, and some of the rumors indicated that these creatures made a buzzing noise like a bunch of bees. I didn't find that, and I couldn't get any testimony of that, but there are supposedly some witnesses that...
and so at some point during his treatment, the doctor felt as though the movements were not his at all?
That's correct. He said that he tried to explain it as best as he could by automatic movements of the hands that sort of guided his fingers in doing what he was doing. The closest thing I've ever heard of this is on Star Trek, when I think Spock was putting himself together. But anyway, they fixed the wound without internal fixation. That means no plates, no pins, no screws, no wires.
Right.
Because when the bone ends were approximated, he couldn't move it.
You're telling me it healed right away?
The whole thing healed, he said, within 24 hours, bone and superficial tissue.
Oh, my goodness. This is hot stuff.
Well, it's an absolutely amazing emotional story, and there was an episode that I'll finish with here, which is even more amazing. I won't go into all the details, but there was a telepathic communication between the being and the doctor, and he said it was like downloading large amounts of information into his head, and it felt like somebody was hitting him over the head with a hammer.
And the nature of the information?
I'll get to that. He said that it was making him sick, like migraine headaches, which lasted for 2 weeks afterwards.
But he knew he was getting it.
He knew he was getting it, and I asked him, "Can you tell us, what it is that you learned from the creature?" And he says, "I'm only going to tell you a very little bit at this meeting." And I said, "Okay, go." And he said the first thing the creature said was that he felt sorry for human beings. And I said, why? And his answer was because the creature said that we could do everything that they could do, but we didn't know how to do it. And number two, the other reason he felt sorry for human beings is, and this is very, very prophetic, he said because we were totally detached from our spiritual self.
Well, that may be so.
Now, when this interview was finished, again, all I can do is verbally describe that here's a man who hasn't talked about this to a soul in 6 years telling us the story. He's now sitting in a chair with his head bent over, his hands out in front of him that are absolutely shaking.
Hold it.
Tears running down his face.
I've got it. Hold it right there.